Welcome back. This is World Insight. I'm Tian Wei. The World Health Organization under scrutiny amid a raging global health crisis. What did the WHO set out to do when it was created? How well has it met its missions already? For answers to those questions and more, I talked with Kelly Lee, a professor of public health at Simon Fraser University in Canada. Here are the facts about the WHO and public health under the global pandemic. Joining us in Burnaby now is Professor Kelly Lee, Professor of Public Health at the Simon Fraser University, who is co-founding the WHO Collaborating Center on Global Change and Health. Professor Lee, a pleasure to have you on our show.
Thank you.
Tell me more, Professor Lee, about how WHO has played its role so far from your observation during the past half year since the outbreak happened.
The organization, as you may know, is the directing and coordinating body for international health work. So when a pandemic like this happens, this is when WHO swings into action. So I think it's done what it's been designed to do. It has two roles, really. One is to gather intelligence about epidemic outbreaks and disease events, which it has done. Countries will report to WHO about what is happening, provide the most information that they have. WHO then gathers that information and shares it with its member states. The second role it has is to alert member states if there is a particular concern that needs to be paid attention to, and the kinds of advice about what countries should do in case of these events. What is also, though, difficult is that this is happening at a time when I think there are a lot of tensions in the world, there's different geopolitical forces at play, and then what we've seen, as you described, an unprecedented pandemic, and it's had impacts on societies that we have not seen before. Mm-hmm. So whole economies shutting down, whole countries, shutting their borders and so on. So I think that's, difficult for WHO to navigate amidst all of this tension, all of this concern.
WHO is an organization that has been arguing that they are what they are as a result of the decision made by their member countries. What do you take about that argument?
Well, to some extent that is true. So when it was set up in 1948, it was set up as a member state organization, which means that it had limited powers. It served member states. It didn't have the authority to walk in and do what it liked. So it had very circumscribed authority. And so when you have a situation where some countries expect WHO to be more forceful, perhaps more, in terms of punitive in some of its measures, if you look back to how it was designed, it doesn't have those sorts of powers. The other thing that it doesn't have is a lot of resources. So member states fund WHO, and they've only given so much funding to the organization, and which means that the funding has to be spread quite thin. And so when you have an emergency situation where there needs to be much more resources, WHO is scrambling around, almost like handing a hat around, trying to get emergency resources, to give to other countries. And so it's very difficult for the organization to then do a lot of the things that people are expecting it to.
So at this point, what is going to be the role and the division of labor between WHO and national governments and governments of regions in this regard?
Well, WHO has only particular functions. Now, in terms of on-the-ground action, it would then depend on what regional organizations might do, but particularly national governments. So where WHO is giving advice, where this advice is translated into action, that's where national governments come in. And so what happens is that we expect national governments to listen to WHO, take this advice, and act accordingly. And what we've seen is a real variation on whether that has actually happened. So some countries have been very quick to act and very effective, and others have sort of maybe took their time a little bit and really didn't take the measures that WHO was urging them countries to do. And so really, WHO can only advise. It can't compel or it cannot force countries to act a certain way. I think that division of labor is where perhaps, we need to look at, do we need an organization that maybe has more powers, has maybe more capacity to require countries to act a certain way.
There are things that are more related to facts, there are things that are less related to facts. So whether WHO has been wrong from the very beginning and has been continuing to do so until today, and therefore for the right reason being criticized by some, or it has been used mainly as a scapegoat for failure of certain governments and certain politicians.
I think we know where the accusations are coming from. It's coming from the Trump administration, and they're making accusations that perhaps all the facts were not on the table as early as they could be. So there was some sort of outbreak. Somebody hid the facts. We don't think they're right, but we don't know fully. So we have to be open about it. We have to allow an investigation, and then who knew what when and who said what when. All of these things are going to take time. I agree that this is not the time to look at those questions. And the real important dates are after January 30th, when every country got the same information and WHO declared an emergency. So there's no disputing that fact. And every country had the opportunity to act at that point. Some did and some didn't. And I think that's where I think we have to see why some countries have done so well in controlling this pandemic and others have done so poorly. And, there is certainly undoubtedly some scapegoating going on. There's an election coming up in the U.S. There's no coincidence that this kind of rhetoric is being ramped up as we get closer to the election.
Another related question is about the funding of WHO. Now, we know that Washington, under this administration, has decided to undercut its funding, which has been there for decades for WHO. What does it mean when an international health organization at the peak time it should function being undercut of its budget?
Yeah, the timing could not be worse. I liken it to, you're trying to fight a big fire and somebody turns the hose, the water off in your hose. It's really an unfortunate and disappointing decision. So we need all hands on deck. This is the saying. We need all hands on deck. And this is not the way to act in the middle of the pandemic. So it will hurt WHO. If anything, the resources should be increased. And what we're seeing is, maybe a shift to thinking about how we could fund global health security properly. Right. We've underfunded it. We've hollowed it out. It's been a kind of, 3 decades of underfunding of public services, and public health is one of those areas that always gets cut. It's kind of expendable in terms of, the shrinking state as we describe it. And so what we're seeing now is the impact of that. We see countries that have very weak public health systems, very weak health systems, clinical care. And those who can afford it get access. Those who don't, they are getting sick and they are not getting access to the kind of treatment they need. And of course, in a pandemic, we need to help everybody. This is a public health issue, right, which means we're as healthy as our neighbor. We are as healthy as the most vulnerable in our societies. So if we don't help everyone, we actually, hurt ourselves.
Another thing is whether reasonable voices will be silenced as a result of political correctness. We have been seeing the politicization of issues related to WHO and its role by governments. And therefore, many of those who are critical voices have been silenced with the fear that they might make statements that would not be considered as politically correct in one side or the other side. What does that mean now? If these voices are being silenced at a time when we need to hear them the most?
Yes, and in a public health emergency, what you want is your public health leaders,
yes,
to come forward and to lead, and not to have political leaders necessarily interfering. What you want is the political leaders to support the public health leaders, to work together as a team. So we've seen that in some countries where, the public health and the political leaders come together and they give the same messages, the same communication to the public. But in some countries, and I have to say the U.S. is an example, is where you see a lot of fractious arguing between public health people, the experts, the people who know about these things, and the political leaders who think they know more. And so you have a division across society. People become very confused. They become very doubtful that, you know, what advice should I think, you know, should I follow? Should I really socially isolate? And then you get a breakdown of the kind of cooperation that you need from the public to deal effectively with an outbreak. This is an example, I think, of bad politics in global health.
Professor Kelly Lee, a great pleasure. Thank you so much.
Thank you for having me. It's great to talk to you.